So my friends, as I am from India, I completed 6 years of medical school back in India. Then I moved to the United States without any clinical experience in the United States. To get into residency, I did about 7 to 8 months of clinical rotations in different hospitals where I got my letters of recommendation to apply for residency and also got some clinical exposure and understand how the system works in the United States. 3-year program that you have to do to be eligible to apply for cardiology fellowship. US citizens also do about 14 to 15 years of training to become an interventional cardiologist. Hi friends, today let's talk about a very common question that I get asked about all the time, and that is, how do you become an interventional cardiologist and how long does it take to become one in the United States of America? As I am from India, I completed 6 years of medical school back in India. Then I moved to the United States without any clinical experience in the United States. And so to get into residency, I did about 7 to 8 months of clinical rotations in different hospitals where I got my letters of recommendation to apply for residency and also got some clinical exposure and try to understand how the system works in the United States. After that, I did 1 year of clinical research in Cleveland Clinic, Florida to apply for residency. So that was 2 years. And then the internal medicine residency is 3-year program that you have to do to be eligible to apply for cardiology fellowship. Now, the general cardiology fellowship is a 3-year program and you have to complete this to be eligible for interventional cardiology fellowship. The duration of interventional cardiology fellowship can be 1 to 2 years depending on the program, and especially programs that also teach structural interventions are typically 2-year interventional cardiology programs. But I did a 1-year interventional cardiology. So it was a total of 6 years for medical school, 2 years of clinical rotations in the United States and research, 3 years of internal medicine residency, 3 years of general cardiology fellowship, and 1 year of interventional cardiology fellowship. So it took me about 15 years of training in the United States to become an interventional cardiologist, as I am a resident alien. I'm not from the United States. Now, some of my friends who had some clinical experience during their medical school did not have to spend extra time or extra months in getting letters of recommendation or doing research. So they directly went from medical school into residency. In that case, they saved 2 years and they did training for about 13 years to become an interventional cardiologist. Now let's talk about a US citizen. A US citizen typically does 4 years of undergraduation, 4 years of medical school, 3 years of internal medicine residency, and 3 years of general cardiology fellowship, and 1 to 2 years of interventional cardiology. So US citizens also do about 14 to 15 years of training to become an interventional cardiologist. Now, after 13 to 15 years of training, what do we do as an interventional cardiologist? So in general cardiology fellowship, during our 3 years of training, we learn all about the heart and its diseases, which includes coronary artery disease, how to manage it with medications, congestive heart failure, reduced ejection fraction and normal ejection fraction, myocarditis, valvular disorders, and a lot of different things. But primarily, we learn how to treat them with medications, how to diagnose these conditions, and we also learn to do procedures like transthoracic echocardiogram, which is an ultrasound of your heart done from the chest. We learn how to do transesophageal echocardiogram as well, during which we go in your food pipe and take pictures of your heart to look at it closely. So we learn all of this in general cardiology fellowship. Now, when we do a dedicated additional training for interventional cardiology fellowship, what we learn in this extra year of interventional cardiology fellowship is how to do more procedures. And specifically, the procedures are mainly concentrated in how to open up blockages in the heart. In this procedure called catheterization or the left heart catheterization, we can these days go through the wrist, and sometimes we have to go through your groin. We take up catheters into your heart and shoot a dye, iodine-based dye, to see if there are any blockages. And if there are any blockages, we also learn how to put a stent in them to get rid of the blockages. This technique, is very useful when someone has a heart attack, a major heart attack, which can be an emergency. So we can take the patient to the cath lab right away and diagnose the blockage and treat it right away. So these are called minimally invasive surgeries, meaning we are just putting a small tube in your wrist or your groin. We don't use any scalpel, we don't cut the chest open, we are not cardiothoracic surgeons, so we don't do open heart surgery. We do these procedures opening up the blockages through your wrist or your groin. We can also use specialized equipment like intravascular ultrasound or OCT, during which we use light waves and sound waves to break up tough blockages or calcified blockage inside your heart vessels. And we can put specialized devices like intra-aortic balloon pumps or Impella, which can support really weak hearts in the acute setting, and it can help to support the heart while it recovers from the heart attack. If one does additional structural training, then in addition to these coronary interventions that I just described, they will also learn how to do transcatheter aortic valve replacements or mitral valve replacements, and this is a very upcoming field as well. I don't do those procedures, so as an interventional cardiologist, you can just be specialized in coronary procedures and left ventricular assist devices like the balloon pump. But if you have additional training in structural cardiology, then you can be a structural cardiologist as well. So treating patients with acute heart attacks is very satisfying in interventional cardiology, because we get to help the patient in the acute setting, and if they come in with chest pain, their chest pain goes away right away after the procedure, and that's a very satisfying feeling. So I think the training was totally worth it.